Okay, thank you and good afternoon, everybody. Thanks for joining us again here this afternoon. Now, I know there's a lot of interest in the region related to relaxing or eliminating the proven measures that have helped prevent the spread of the virus. And again, we all recognize the impact of the economic slowdown and how its effect is on the people of our community. And this has been a very difficult time, particularly for those of disadvantaged communities, and this isn't lost on us. But to be successful in recovering, we have to avoid a rebound in cases, or like the 1918 influenza pandemic, a devastating second wave. As I demonstrated before, that second wave was actually worse than the first wave here in St. Louis. And that's because some restrictions were removed at that time, which were able to stop the spread, but ultimately because the restrictions were relaxed caused that second wave. This time we'll have to do things very smartly, and we can do that. But first we have to remember where we are right now. We're still in the middle of what our modeling shows to be the initial crest of our first wave of infections. And so now is not the time to let our guard down against the virus. In the coming days, we'll see an increase in the number of infections and hospitalizations, and this will continue to test our carefully prepared plans and health protocols that we've put in place. Our hospital leadership teams are meeting every day to make sure we're prepared for what this increase might mean for our staffing, for our personal protective equipment, for our ICUs, and for our ventilators. One thing that we do know, the steps we enacted weeks ago are working. Staying at home, washing our hands, and practicing social distancing has without a doubt been very effective in slowing and preventing the spread of the virus in this region. Again, these life-saving measures should remain in place until we have robust testing and tracing capabilities and have seen reductions in our new infections and hospitalizations. Even as other cities, regions, and states talk about reopening some businesses and loosening their restrictions, we have to remain vigilant. We have not seen the worst of what the virus can do in our region. So now let's take a look at where we are today. As of today, we have 694 hospitalizations, which again are COVID positive and patients that are under investigation for coronavirus infection. And that number is about the same. It's down a little bit from 600, and I apologize, it's up a little bit. We had 685 hospitalizations yesterday. But remember, we're still way up from where we had started in early April. There are 170 ICU patients, which is a little bit down compared to 185 that were in our intensive care units yesterday. And we have 123 patients on ventilators, which is down from the 133 we had yesterday. And again, on the good news front, another 52 COVID patients were discharged yesterday from our hospitals. As of today, our hospitalizations are significant from where we started in early April. More people in the region are being infected and hospitalized as the virus continues to spread and we inch towards our crest. We have to continue with our proven steps that are working to keep people in this region from becoming infected and from being hospitalized and from dying from this infection. So please stay home, keep washing your hands, continue to clean surfaces, and practice social distancing. And this will help as we continue to work to stop the spread. And now I'll be happy to answer questions from the media.
Among the counties that make up the St. Louis region, many have shown no deaths at a very slow rate of increase in cases. Does this indicate a lack of testing in these areas or a lack of spread due to factors like demographics and geography?
It's probably a combination of both of those. So we know that there is limited testing, not just in more rural or suburban areas, but also in our urban areas as well. And so there's even less testing going on in some of those outlying communities. But we have known from previous pandemics that the spread makes its way from the urban areas out into the rural areas. And so part of it is timing. Part of it is, as the questioner says, some geographic distancing, so you have some natural sort of social distancing as well. And so it's probably a combination of all of those factors.
There is talk about the need for additional testing. Why is that? Is that because of a shortage of testing kits, or are not enough people in the community going to get tested?
It's a combination of those. And so we are always playing catch up with the amount of testing kits that we have. So if you remember me talking about, there's two different types of testing. One is for surveillance and one is for diagnostics. Right now, because of the testing criteria, which is a large part based on the number of testing supplies that we have, we're doing almost exclusively diagnostic testing right now with very little surveillance testing. So that's the point that we would like to get to with increasing testing capabilities, is to get to more surveillance. So how many people out in the community actually are infected with the virus instead of the ones that are sick enough to seek testing. And so that's a big reason for that.
The same reporter asks a follow-up question, writing that they were at a testing site on Jennings Station Road for 3 hours earlier today and saw 2 cars at that site during the time. Why did that testing site not appear to be overcrowded? Is it because the criteria to receive a test are so strict?
That could be a reason. So there's probably multiple reasons that could explain the low volume at that testing site. So one could be the testing criteria. So as I said, the testing criteria now, you still have to be symptomatic. You still have to answer questions about were you around somebody with COVID. But I can tell you that when I went and visited sites yesterday in the city, both at CARE STL and at Affinia, in talking with the people at CARE STL, their sites were full. And so there's a lot of different factors that would go into why one site would be busy and another not. There's also some concern about people wanting to get tested as well, even if they're symptomatic, because of some of the restrictions that would be placed on them. So for instance, if somebody was tested and quarantined, but didn't have the means to support themselves for those 2 weeks of quarantine, we have heard that people are actively not seeking out getting tested because of those reasons, which is something that we need to work on if we're going to have an effective response to the pandemic.
Another reporter asks, unlike other parts of the state that may reopen on May 4th, we know St. Louis County and City will extend their stay-at-home orders. When should the St. Louis region reopen, and what data would you want to see before advising a reopening of the St. Louis region?
Well, we've been working with public health and with the elected officials, and I think their position was fairly clear that they would take a look at where we were by mid-May. So there's a couple of criteria that we believe are important for us to entertain whether we should be opening up or recovering the economy. And so some of that is looking at our number of hospitalizations, because that's the best barometer that we have right now for community spread, and whether that data is trending down. We also want to make sure that our healthcare systems have recovered enough. And so what I mean by that is we have to make sure that we have adequate personal protective equipment for our employees if we're going to start loosening restrictions. If we loosen restrictions, again, you're increasing the probability of transmission, which could result in a rebound of cases. So what we don't want to happen is for those cases to rebound and then the healthcare system not able to adequately take care of that increase in patients.
When you say the St. Louis region could peak this weekend, what numbers are you talking about to measure that peak? Would that be infection rates, death rates, or something else? And why is that number important to you in determining the peak in the St. Louis region?
The number itself isn't as important. And really the peak, I sort of want to dispel this myth that, we're going to hit this peak and then all of a sudden drop off. We're not. It's going to be a slowly rise on a crest where we think we'll hit the total number of patients hospitalized will be our high point, and then it'll gradually come back down. And so it's not as sharp of an increase in dive as you would think. the number that we look at is our hospitalization number. We don't have a true reflection of the infected numbers because there's people out in the community right now that are infected that will never be tested, that will never come to the healthcare system, and so we don't know who they are, which is why we're using hospitalization rates because those are true positives. We know that they have COVID. We know that they're sick enough to be in the hospital, and so we're able to use that as an ongoing metric. And then we don't track the death rates either.
Is the peak for hospitalizations in the St. Louis area still expected to occur on or around Saturday? And what is the projected number at that time? And are hospitals prepared, or how are they prepared?
So, according to our model, that crest in that wave of infections is still expected to be on or around the 25th. The modeling numbers tell us that it's anywhere between 600 and 700 patients. So there's the band for you. And then, I'm sorry, the last part of that question was...
Are hospitals prepared?
Are hospitals prepared? Yeah. Yeah. I mean, we're prepared as we can be. So, we've gained a lot of experience in going through this pandemic. We've taken all the precautions that we can. We have our supply of PPE. We're still operating underneath crisis standards, but we're still there. And so I believe we're as prepared as we can be.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.